In the Affordable Care Act, there was a call for the creation of an independent payment assessment board that would both assure that Medicare was proceeding on an economically solvent basis, but also making recommendations for how to bring private insurance and public insurance programs together and reduce some of the administrative burdens on doctors that spend over $30 billion a year just dealing with insurance companies. So do you think we need to, even if we keep a mixed public-private system, bring those closer together in terms of the way they pay, what they cover, whether they cover nurses providing care? What would you recommend?
Well, first of all, there are requirements in the Affordable Care Act to do some of that. We now have a requirement for universal forms, and we have a requirement for at least a minimum category. We call it the bronze plan in the exchanges of 60% actuarial value, goes all the way up to 90% with the platinum plan. So we have some guidelines, some requirements with regard to the universality of care and the universality of reporting. I think we could go a lot farther. My concern is that ultimately, if we don't have a single payer system in this country, and I don't see us having one anytime in my lifetime, what we still have to do is coordinate this public-private infrastructure more effectively. And we don't have any mechanism to do that. Just like we didn't have any mechanism to do that in our banking system in the 19th century. That led to our country deciding to create a Federal Reserve System to coordinate a private banking system, which today works reasonably well. We may have fault or find fault with certain decisions, but no one would ever vote to repeal our Federal Reserve System. I think we need a similar federal health system that allows us to coordinate public and private entities a lot more effectively going forward. That, to me, is the alternative to a single-payer system in the country that could bring about a far better organizational strength in this collage of subsystems we work with now.